My name is Gwendolyn Williams, and in 2006, I was diagnosed with Graves' disease. Graves' disease is an autoimmune disorder that leads to overactivity of the thyroid gland, otherwise known as hyperthyroidism. An autoimmune disorder is a condition that occurs when the immune system mistakenly attacks healthy tissue. I'm married and I have one child who's now out of high school into college, and I've been married for a lot of years. I've been married for over 20 years. I have a good relationship with friends and family. We socialize with friends and family pretty regular. We work every day, and we do things, a lot of things as a family and with our family and friends routinely. Well, before I found out I had Graves' disease, or I was diagnosed with Graves' disease, my overall physical health and mental performance was very good. I know now, I didn't know then, was simply that I had times when I was a lot younger, because I was diagnosed in my early to mid 30s. But before then, I would say most of the time it was in what I call now is remission. Basically, I didn't, of course, know I had it. So my lifestyle, my overall mental health was very good. I realize now that at that time it was probably it would be out of remission, where I would be like not clear, cloudy, literally like a fog in my mind. Things, everyday routine things, I would have to stop and I would second guess, like, is this right? It could be from cooking, which is something I love to do, to driving a car, forgetting how to parallel park and not realize that I'm actually not remembering how to do it. Or to something simple as, I love to exercise, all forms of exercise. My favorite thing to do is yoga and running and everything in between. So my balance would get off. I would get, for lack of a better word, just pretty much clumsy. And I would lose my balance, or it just always seemed to come out of the blue. I ran maybe 45 to 50 miles a week every week. I would be good and feeling good, and then I would have moments where and then my weight would be up and down. So, but not all the time. It would seem that I would go for months, and then I would just seem to gain weight for no apparent reason, when nothing changed. And each time, and I went to the doctor regularly, routine visits. I was never sick, no colds or anything like that. So just routine doctor visits, and would have myself checked and blood work, and then never found anything. So you keep moving on. It will go into remission again and stay for months. So I lived like that pretty much most of my life. 12 or 13 years old, I remember that far back having symptoms. Now that I know what the symptoms are, or all the symptoms that I've experienced, I remember having them that far back. The different aches and pains, it just became more profound, of course, as I got older. If you're healthy and you take care of yourself and you're not sick all the time, people don't believe you. They don't think that. So I guess people would think, even doctors, well, there's nothing wrong. So you move forward, basically. So, but my mental health, my physical health was great, excellent. And I felt good, and when I would have those moments, I would chalk it up to being female, that there were just times when you just don't always feel your best for many reasons. It could be simply because you just have done too much. And I worked every day. I've always worked every day. So, you just have a lot on your plate. So I would just draw back a little bit and do what I need to do to rest up, so to speak. And then I would move forward. And I kind of went in and out of that off and on. And it would be very long times in between before I would feel overwhelmed with the symptoms again. The first changes big changes that were happening I would say were probably in my late 20s, and which would have been after I had given birth, had a baby, and maybe I would say she would have been maybe about 2 or 3. I can remember distinctively being at work one day, and I took a run, and I remember feeling just extremely exhausted. Like, oh my gosh. First thing you think is you got a toddler, 2 or 3 year old, is, am I pregnant again? That's what I thought. And so you start running through my mind what I felt like when I was pregnant initially, the first time I realized I was pregnant, and what I felt like in my symptoms. And I had a lot of those symptoms. I thought, okay, let me just wait and see how I feel. And I know how that went. I know each pregnancy is different, but like in a couple days or so, it passed, just went away. But basically, I remember feeling very tired, very sluggish, and after a run, you feel sore. I know what that feels like. I have been doing it for a long time by then. But I remember feeling just like exhausted, like I had run a marathon. It was just way over the top for was something I had been doing all the time. So my first reaction was, I'm going to go to the doctor. It doesn't subside or go away in a couple days. A couple days it was gone. So I didn't go to the doctor out of the ordinary, because I never needed to go to the doctor out of the ordinary, or out of the realm of annual exams. When I would go see my doctor for my annual exams, I would mention those things. We would do blood work. We would look at everything that would be to look at, your electrolytes, your iron, your calcium. You look at all those things, and all those things were always good. Um, Levels will be up at first. Now this is before I was, mid-30s, early to mid-30s. Everything was always good. So anything never it seemed to be out of the ordinary. The big thing was when got closer to 35, the closer I got, and then it just, boom, just came out. And I started gaining all this weight, and my weight was going up and up and up and up and up, and it was not making any sense. And physically, I just looked ill. Got sicker and sicker and sicker. I want to say that there are lots of symptoms that can be had. I've had, and I'm sure there are many some that I haven't had, but based on my research and all the doctors I've talked to, the specialists, um, to I've had them all except for the bulging eyes, which that's when the eyes get really big, and it's very noticeable. Normally, when I say normally, I guess people have it and it's caught early, they take the medicine. But I had it for so long that I had no calcium, I had no iron, I had no vitamin D, none, zero. That's what they told me, and it was just they had no idea how I still had teeth, because and healthy teeth, because I had none of that. So I had to take calcium, prescription grade calcium, vitamin D, and iron for almost a year, about 8 months. Your skin becomes very dry. Sometimes, like scaly. Your joints swell. Your hands swell. I've dropped many, many things over this time, because you just don't realize it. That the feeling is there, but the hands swell, and you find yourself not being able to hold on to things. My hands are swollen right now. They swell. You swell, your joints swell, you ache, you get sore, you get achy. That's why exercise is crucial. They tell you if you have Graves, any exercise, any disorder, or any, especially autoimmune, that you must exercise. Water exercise is excellent, and weight bearing exercises are crucial when you have Graves, because of the joint soreness and stiffness and swelling. Your hair can become really dry and brittle, and most people with Graves lose their hair. They lose it. I've been blessed where I haven't lost my hair. I have a head full of hair. It grows actually very fast. So I don't have a lot of hair on like my body. I have hardly no body hair. I didn't understand. I never thought of that most people in my family, even the women, have hair on their body. I never gave it a thought. But that is why. I'll take off my glasses. I have this part of the eyebrow, the outer part, that's a symptom. I never had that. I never realized why I have this. Very little. I have hardly no eyelashes. And then the darkness, like under the eyes. And the weight gain, that is usually, when you have the weight gain, it's usually the very last thing, one of the very last things. When I was diagnosed. They told me what I had. I had heard about it, and I didn't really know what it was. I didn't know the details about what it was. I didn't know anybody in my family had it, had never talked about it with anyone. And then upon being diagnosed and talking to my family about it, like at the time my mother was still alive, my mother, aunts, older family members, like in their 60s on up, come to find out I have a cousin, a first cousin that is in her 70s, mid 70s. She she has it, and then after talking to her, from what she tells me, it sounds like her granddaughter, who's now in her late 20s, she has it. So it wasn't something that just came out the clear blue. And then my aunt, or cousin who's in her mid 70s, she told me that another family member prior to her was diagnosed. My siblings, none of them have it or anything. I think it probably just maybe skipped some generations. So found out I had it. Didn't know really what it was. Talked to family, found out that yes, it is in my family and very, very close in bloodline, and it's genetic. It could be genetic. It can be hereditary. Who knows what else could have been lying dormant, but for whatever reason, that was in me. And stress, a stressful family situation. I believe my personal family situation is what brought it on. When it did, just come out full bloom. When they first told me that I was diagnosed with it, there at the doctor's or at the hospital, not knowing what it was, but telling me, like I said previously, or like I said in the before, was here's what it is, here's what normal levels should be, here's where yours are, which mine were off the charts. They were nowhere near normal. They had no idea how, like I said, was functioning with my levels so out of control. I was walking around with my blood pressure 100 over 200. My whole body was just, my major organs at that point is what they told me was shutting down, or beginning to shut down. And that's why I was so swollen and like I was about to pop. And I just looked just a hot mess. So my first reaction was I was too sick. I feel like now to be shocked by that kind of news, or here's what's going on with your body. Because I was just that sick. My mind was just so foggy, so unclear. It registered, but it didn't really register. It was like kind of distant. To literally, my first reaction was, can I exercise again? Am I going to be healthy enough to exercise again, to run, to ride my bike, to exercise, to just take care of myself? Because all I knew was that, okay, I'm sick, and I had been sick to some extent off and on all my life. Especially as a young kid. I was sick a lot. I was really sick as a younger kid. Before I became responsible for my own health. But that was to no fault of my mama. I was dealing with graves, and she didn't know I was dealing with graves. That was the reality. That's what I realized later. There are a few treatments that you can have, but in essence, they are all the same. They all accomplish the same thing. You can go with a surgery that removes a portion of all of the thyroid gland. But if you don't know how much of the thyroid needs to be removed, which you never really know that, unless the thyroid has been damaged in some way, or it's severely cancered, or it just something like that. Like mine was very inflamed. My neck was like it was huge. It was like this big, extremely inflamed. And you don't really know how much of it to remove. So you can go in and remove a portion, or you're guessing, you're taking the best guess. But some people out for surgery and they have portion all removed. Or you can have radioiodine treatment, which is really just dumping. There is radioiodine already in the thyroid, but they go in and they dump excessive amounts in pill form into the body, and in different micrograms, depending on what you need, and you can have that treatment. In essence, the outcome is the same, but when you do the radioiodine treatment, what happens is there's more control over how fast and how much of the thyroid they shrink it down. So you take the tablet, and the thyroid is like time activated. It's activated, and the thyroid shrinks to a certain point, and then it stops shrinking. And then eventually, of course, all the radioiodine is flushed out of the system through, in the urine, and you have to drink plenty of fluids and all of that, and they give you instructions for that. But the outcome is the same, but there's more control, because you may get it down far enough where, okay, this is small enough, and they can start treating you. But the thing is, each person needs something different. So they pretty much, I chose the radioiodine treatment, not surgery, because it didn't make sense to me for them to, I don't care how they go in, to take out something that you don't know needs to be removed. So I did the radioiodine treatment, but I was, mine was so inflamed, I was so ill, that I had to have treatment twice. But because it's radioactive, you cannot have radioactive treatment back to back like that, at least not this kind. So I had to wait about a year, had the first treatment, but I didn't expect to give it twice, because they said they had never had to give it twice, and that high of a dosage. So I had a 20 microgram treatment tablet, and I had to be quarantined. So like at the time, my daughter was middle school age, I believe. Either way, she was a child, and I could not be around children or pregnant women at all, never, ever, not an option, for 7 days. My husband could stay in the same house with me, but we could never be in the same room at the same time. Anything that I used, we could not, of course we would share plates and cups and stuff, but we could not do that. I had to wash my things off separately, and then put them in the dishwasher. We had to use separate stuff. We couldn't be in the same place at the same time, or the radiation from my thyroid would kill his thyroid. A year later, about 8 or 9 months later approximately, I had to have that treatment again, because when you have Graves and they have to shrink the thyroid, you can't just start taking Synthroid, which is the thyroid medicine, the thyroid replacement, the synthetic thyroid replacement, because in essence you are dumping more thyroid medicine into a body that already has too much, and that could kill you. So what they have to do is prepare the body to take the thyroid medicine. So and each person is very different, but for me it meant, first of all, shrinking my thyroid, because I had so much of it in my system that I was like, not only was I had every symptom that there is to have. I had every single one to the extreme, except for the bulging eyes. And I had the treatment, was quarantined for a week, and then in that time, but before taking the radioiodine treatment, they have to prepare your body with other medications for about a month before. I had to take a pre-treatment that boosted, they had to protect my heart from the radiation before I could take the radiation. After 8 months, and then you take a medicine to kind of stabilize you. After the radioiodine has passed through your system, you go back, and all the time, every 6 weeks, they're drawing blood. They're sticking me with a needle, and they're drawing blood every 6 weeks for I don't know how long, for how many years. I had to have my blood drawn literally 6 to 8 weeks, because they can't do anything, make any changes of any kind without knowing what your levels are. The only way to know that, once you take away or diminish the thyroid gland, is to draw the blood and get your reads directly from the hormones being secreted from the brain. So I had to have that treatment twice, because the first treatment wasn't enough. Even though it had shrunk down to about half, it was still spitting out way too much thyroid hormone. They had to give it to me again. So it took almost 2 years to even prepare my body to start taking the synthetic hormone, which is Synthroid. That journey was it was trying, because I couldn't work. I had to resign from my job, because I was not only, first of all, that sick initially, but the recovery is it's just rough. There are many symptoms, and each person has different ones that can come along with the radioiodine treatment. So I had the treatment twice, and then after the second treatment, so it took almost 2 years to prepare my body, to get my thyroid shrunk down to almost nothing. And now I have no thyroid. I don't have a functioning thyroid. The gland is still there, if you want to call it that. It's very, very minuscule. but it's not spewing out anything that that my body can work with. So and I started kind of at the highest dose when my body, you have to become hypothyroidism. You have to become hypo instead of hyper in order to take Synthroid. And when it finally got me down to being hypothyroid, having hypothyroidism, is when I began the Synthroid. And I started at the highest dose, which I believe is, or maybe just below, I think the highest dose, maybe about 200 micrograms. I started at like 175. So I've bumped down every dose, one dose at a time, to about 125, and back up, depending on what my body was doing over the last, maybe 4, 5, 6 years now, trying to get it right. And then being female, and now over 40, the other hormone changes going on that have to be addressed, that are right alongside what's going on with the thyroid. So all of those things, and because a lot of the symptoms that you can have when you're diagnosed with Graves, or before you're diagnosed with Graves, properly diagnosed, and women can be confused with anything else a woman can deal with. Think of it, and the symptoms that you can have with Graves, you can have them as just as being a woman. Graves is as serious illness or disease or disorder, whatever you want to attach to it. It's as serious as anything else when you have to live with it every day. And I just want people to be patient with folks that have it. Be patient with those of us that not only have it, but live with it, but live with it well. Make the effort to take care of ourselves and do the right things. Sometimes you still get weary with it, and you just need a moment. You just need people to let you be in that space and have that time, and just but don't take that. Don't use that as a tool to mistreat people, because I don't feel good. Don't be like that. And then just be patient with yourself. That's the biggest thing. As I learn new information, I share them with people. I'm always sharing. My husband and I, he's very good. He's a huge support, huge support with the researching, with new information. He's always giving me information, new information. He find out new things. We find out new things. We talk about them. We share them. So I am very, very grateful for that. Because it would be impossible to live in a household with people. You live in a household with people, and they didn't give you support you need as you need it. So I am very grateful to my daughter and to my husband, because without their support, oh my gosh, I can't even imagine. I always tell people, at work, I just love going home, because some days I just be exhausted, and I get home, and just being home for a moment, it's just, I'm revived. So if you're feeling not well, don't ever take for granted, or if you seem to always be sick, get your thyroid checked. Don't let your doctor tell you, you don't need to do that. Don't ever let them tell you, you don't need to do that. You have them check your thyroid. And then take charge of your health. And then you do some research and find out, what does that mean? And that's all that I have.